size fits all, and that means if it's a major surgery or just vein care, it's kind of all the same types of things, so it looks scary in major surgery, but this is basically like starting an IV. That's all it is. We're just starting an IV. We're putting a little laser fiber in the vein that looks like fishing line, 80-pound test for you anglers out there. And we're going to put that in a short segment of vein. Then we put very dilute numbing medicine around it, around the vein, and laser. It's mostly saline. And then the laser part takes a minute or two. So it's a lot like a moonshot. There's a lot of preparation, and then it's 2 minutes here in space. So anyway, that's what we're doing. We're basically starting an IV here today. And what we're going to do is we're going to ask you to bring your gown up to britches level, a little higher. Do you have anything on underneath there? Okay, good. Here's what I'm going to do. This is a sterile towel, and I'm just going to tuck it under your britches here because we're going to prep this area because I got to get in here with my ultrasound probe. And so,
are we using 65 or 45?
45 would be great. Yeah. And so we rarely even ask patients to do an underwearectomy. Okay, we just, you know, don't necessarily need to do that. We just put a little sterile towel right underneath this area, and we should be just fine. And this is just some clean alcohol here. What we're doing here today is probably the biggest thing we do, and that's closing a vein with laser. And laser's sexy, and people are attracted to laser. Sounds, 21st century and all that, but basically laser is just a very hot poker. It's got the end of that laser is very, very hot. So what we're really doing is just cauterizing the vein, or basically burning it and getting rid of it, because the vein is not working properly. It's not taking blood from the legs to the heart. The valves have gone bad and the blood's going the opposite direction, so there's like a fire hose here pushing blood the wrong way, and it causes symptoms: pain, swelling, restless legs, throbbing, all sorts of things that aren't good. And so the vein's no longer doing what God intended it to do, is just take blood the other way. So by getting rid of it, we're actually going to improve symptoms. These veins under the skin are totally expendable. We don't need them. In fact, they're causing a problem. They're not making this patient feel very good. The important veins are in the middle of the leg. There are veins that go right through the middle of the leg. Those are the important veins, are the deep veins, and the veins that we think about when we talk about deep venous thrombosis or blood clots that go to the lungs and these kinds of things. But these veins under the skin they take less than 5% of the blood flow out of the leg, and so they're totally expendable. We don't need them when they're a problem. So by getting rid of them, we're going to improve things. We're going to divert all the blood, will be diverted into the normal veins with normal valves. So anyway, that's what we're doing. We're just getting rid of a short area of vein today, because this young man who's a nurse, and we treat plenty of nurses, plenty of cosmetologists, because the main causes of vein problems are heredity, or the wrong parents, and then the second main cause is pregnancy. So essentially vein disease is the only disease I know caused by parents and children. Okay, those are the top two causes. But in Mark here, he's also a nurse. They spend a lot of time on their feet, and so occupations is probably number 3. Obesity, I put in there. Trauma, sometimes to the legs, but it's basically having the wrong parents is the main thing. And so anyway, Mark was treated elsewhere and incompletely treated, and frankly, we see a lot of that. At least every other day, we see patients who have been treated elsewhere and have been incompletely treated and still have symptoms. And frankly, we're used to darn near 100% patient satisfaction at Vein911. because we know what we're doing with an ultrasound. We know how to find the leaks or the problems in these veins. Based on background and training, ultrasound is very important to the whole treatment plan in vein care. That ultrasound exam has to be performed correctly and then interpreted correctly. Well, I'm a radiologist. We know a thing or two about imaging and ultrasound. It's going to be hard for other practitioners to match that experience. Number two, as an interventional radiologist, we're like image-guided surgeons. We use imaging to do surgery. It's going to be hard to match that experience. A lot of people don't realize that interventional radiologists invented stents and angioplasty, a lot of the things that cardiologists, vascular surgeons, and several other specialties use. But image-guided procedures is what we do. It's our specialty. So venous disease today, there's little to no role for surgery in venous disease, and we're the experts with catheters and minimally invasive treatments. So we got that angle covered. The third thing I'd say in the shameless self-promotion of here at Vein911 is I'm board-certified phlebologist or vein care specialist or a diplomat of the American Board of Phlebology. I believe there's only 565 of us in the United States. So I do have 3 board certifications: diagnostic radiology, interventional radiology, and phlebology. So if you have a vein problem, medical or cosmetic, we're going to get rid of it. So anyway, we do see a lot of patients who've been undertreated, and in my opinion, the main reason for that is poorly performed and interpreted ultrasound, and number 2, not performing a procedure called ultrasound-guided foam sclerotherapy. There are only 3 ways to get rid of veins, and thank you, Mark, for putting up with this big explanation before his procedure here. There's only 3 ways to get rid of veins. It's surgery, but not the ligation and stripping and the old-fashioned kind of surgery that people are familiar with. But nowadays it's termed ambulatory phlebectomy or microphlebectomy, which is basically you can pull out these varicose vein clusters through little tiny incisions or needle holes. And many practitioners do that. I do not. So that's one way to get rid of varicose vein. The second way is with heat, using laser or radiofrequency ablation. I use laser. However, you can only treat straight veins when you're using heat or laser. But it's easy to see that a lot of varicose veins aren't straight. Now, the main problem is the straight vein, so you got to take care of that, but you got to get rid of all the other stuff too. And so many practitioners use laser radiofrequency, but they'll only get rid of that straight vein. Then you only have 2 options to get rid of the rest of those venous branches. One is phlebectomy that I just mentioned, and the only other way is sclerotherapy, or what we term ultrasound-guided foam sclerotherapy. So let's talk a little bit about that. That's the third way we can treat a varicose vein, is with ultrasound-guided foam sclerotherapy. Well, I do that. I'm pretty good with an ultrasound and a needle, and there's a lot of bad varicose veins going on under the skin that you can't see. And when we inject these varicose veins with foam, that foam goes in every little nook and cranny and every little branch, and so we don't leave anything behind. We don't leave any bad veins behind. And frankly, if all I could use was foam, I could get rid of any varicose vein anywhere in the leg. It's really the only technology that we would need to use. But in any case, if you're just offering laser or radiofrequency ablation of varicose veins in ambulatory or microphlebectomy, in my opinion, many patients will remain untreated, and the proof's in the pudding because we see them all the time. And most of these patients require either additional laser, like we're going to do here today, but most of them require foam sclerotherapy. Why isn't more of that done? Frankly, it takes some skill and experience. It takes imaging skill and experience, and injecting foam in the wrong place can be a very dangerous thing. So you want to be sure you know what you're doing with an ultrasound probe. Many practitioners use ultrasound technologists, which are great. I use an ultrasound technologist, but sometimes those technologists may know more than the doctor about how to use that ultrasound, and I don't think that's necessarily ideal. So anyway, I am a recovering assistant professor. I can spew a very long time. But anyway, if you want more details, YouTube Nation, subscribe to our YouTube site. Like us on Facebook, check out my website. There's tons of great information there. And of course, you're always welcome to give us a call here at Vein911. It's pretty simple, 855-VEIN911. We're here to answer your questions.